We have made progress, but obviously not enough. One death is too many, and just last month we had an individual die in that facility. So our work is not done.
That's how the ACLU of Kentucky sees progress inside Louisville's jail, which went nearly 1 year without a single death until May.
Our Ian Hardwick tonight is hearing how they're coming together for change following criticism.
The overdose reversing drug Narcan is now available throughout Louisville's jail, with an alarm that calls for help if the life-saving box is open.
And when individuals leave, there is a Narcan vending machine as people exit the facility that they can get for free.
It's an effort to stop overdose deaths at Metro Corrections, one of many changes made since Director Jerry Collins arrived. Kungo Jaguna, ACLU Kentucky's policy strategist, credits Collins for allowing the activists inside the jail for educational programs and voting registration. It's an example of how community stakeholders for change at LMDC, which has met outside the jail in the park mourning the deaths over the past 3 years, has been critical of the jail, but also has worked with them on changes over the years.
We meet quarterly. In fact, we met just this week.
While Jaguna wants better visitation for inmates, he acknowledged that the free calls they can make on newly assigned tablets is a good change. Also on the jail's horizon, an infirmary inside that's under construction, which will improve security by lowering the number of transports jail staff perform, while also providing greater health care. Its single-cell holds for inmates at risk of self-harm are also slated for vital monitoring improvements, which use radar to read heart rate and breathing levels. The additions show how corrections officers juggle their responsibilities to the inmates in their care.
In the same day, they can be a mental health counselor, they can be a police officer, they can be an EMT, and usually they're always the first ones there.
While Collins and Jaguna applaud improved conditions, the ACLU strategist worries too many people enter the jail in the first place.
And we need mental health beds, detox beds, not cages. That's what this community should be focused on. That's what our budget should be paying for. And we don't think enough of that money goes to prevention. Instead, we're spending way too much money locking up people who need our help and compassion.
But he says since one death is too many, the progress measured in small victories must continue. In Louisville, Ian Hardwick, WHAS 11, on your side.
In addition to the physical and technological improvements at the jail, Collins is seeking a raise for all corrections employees on their new contract, calling it professional pay for professional work.
Metro Council will vote on that next month when they return from break.